Welcome, everybody. So, you won't believe where I ran into Adam. I was at the biohacking conference, and a random guy grabbed me and said, "Your shoulder looks crooked." I said, "Okay." And he pulled me backstage, and there's Adam with a topless Dr. Joseph Mercola pulling his muscles and making them straight. And I'm like, what is going on in this room? And I realized that Adam was partially brought there by Dave Asprey to work on the VIPs and speakers in between talks because of how good he is at what he does. So, Adam, thank you for joining us.
Thanks, Kashif. It's a pleasure to be here.
So, how did that happen? Like, I come into this room, and yeah, my shoulder was crooked. I'll admit it. And yeah, you fixed me. I'll admit that too. And how did you end up working with Dave and ending up at the conference?
So I was part of Dave's Upgrade Collective. I've been
Okay.
a member of that for over a year. And so I'm a shockwave therapy practitioner and trainer. So they basically have like a expert people come on the
Right.
Upgrade Collective sometimes, and they asked me to come on and teach them about shockwave. And then Dave was quite interested in the company that I work for because they make one of the best shockwave devices in the world. He was interested in finding out more about the shockwave device. So we were trying to get me to the conference last year, the one in LA.
Yeah.
But they didn't have FDA approval in the United States for the new device until December. So I couldn't bring it over and I couldn't attend that conference because they didn't have FDA approval. So we set it up for this year, and basically Dave invited me to go show him. And while I was there, I was like, well, I have the machine here all weekend. I'm like, if you want, I can treat, the speakers and VIPs and stuff, because, might as well get people to know about
Yeah.
this device and what it does. So, so that's how that happened. So that
It
was
was, yeah, it was an
cool.
awesome experience. I mean, I truly needed support on my shoulder. First of all, I had been traveling for like 3 weeks straight. I wasn't sleeping properly, wasn't eating properly. As much as I could try and control that, it's still difficult when you're not at home base. And so this ongoing issue I've had for 20 something years, my shoulder kind of expressing myself when I was walking around like this. And what you did to me hurt like hell, but I got better. So we're going to talk about the shockwave, but even the work you did on me, just the physical, it seemed like there was a different level of knowledge than the typical, say, chiropractic adjustment. So where did that training come from?
So I do a technique called ART, active release techniques, and I've been doing that for over 16 years. So it's a technique developed by Dr. Michael Leahy. He's actually in Colorado, and pretty much all the sports teams in North America, all the professional teams, will have at least one guy, allied health practitioner, that uses ART because it's so effective. Like if you go to Leahy's clinic in Colorado, he's got like NHL players, NBA players, Major League Baseball guys like coming through the door all day long. So
Yeah. And I
I learned
remember
from
you,
him directly.
okay. So, and I remember you talking to you after the fact, and you asked me where I live, and within minutes you're telling me, "Oh, here's a guy that works on the NHL, and I'll set you up with him." He works on pro athletes, so you have this network you're connected to globally. I guess it sounds like.
Well, once you're in the industry for long enough, you kind of learn you learn who's good, and that's I was talking to you about my mentor. So he lives, in that about an hour and a bit away from you, and he's probably one of the top chiropractors in Canada, if not the world. He's been to 6 Olympic Games, and he's the reason I became a chiropractor.
And what were you doing before?
Oh no, I've always wanted to be a chiropractor. So like my background story is basically I used to be a decathlete, so I did 10 track and field events, like
Oh wow,
Bruce Jenner.
very
Used
cool.
to- Yeah, so pole vault, discus, javelin, high jump, 400 meters, 110 hurdles, 100 meters, 400 meters, all that. So when I was in year 11, I tore my hamstring, and I was going to see a physio for. Again, this isn't bad mouthing physios. This is just my personal experience. Um, I was seeing the physio for like 6 months and about twice a week. And this guy was good. Like he worked with the town I'm from, all the best figure skaters in Canada train there and
Hmm.
in Barrie, Ontario. I'm sure you probably know, like
For sure.
Maricopa.
Yeah.
Yeah.
Not far from
So
me.
yeah. So I was seeing him and I just wasn't getting better. And then a guy on my track team was like, "Oh, you should see this chiro in my town, which is Orillia, which is 20 minutes north of where I lived." And he goes, "Oh, he works on Olympians and stuff, and he's great." So I went and saw Dr. Larry Bell's his name. And I went and saw him. And after my second visit, I said to him, how long do you think it'll be before I can get back running? And he kind of looks at me funny. He goes, "You can go for a run tonight." And I'm like, bullshit. Because I couldn't run. I couldn't run. Like it would hurt within, 20, 30 meters. I'd have to stop because the pain was so much. And that was the first time I was able to run in over 6 months without pain.
Wow. In one session.
After two, that was the second session.
So what exactly did he do to you?
Well, so I was learning pole vault at the time, and one of the downfalls of learning pole vault is sometimes you can miss the mat. If you don't plant the pole straight overhead, if you plant it sideways because of physics, you
Yeah.
land sideways. So you can.
Oh, wow.
I actually missed the mat, so I fell from like 3 meters onto like the rubberized track,
Right.
which isn't really good for your musculoskeletal system. I'm like, I think now I'm like, if I did that now, I would break like so many things. But when you're 16, you're kind of invincible, aren't you?
Yeah.
But yeah. So, anyways, that's how I did that, and so he identified the physio kept working on my hamstring, which was one of the problems, but he wasn't identifying the other problems. So my pelvis had actually been moved, like it got torqued or torsioned.
Okay.
It was on the right side. It was sitting anterior compared to the left side. So that puts more tension on the hamstring because it lengthens where the insertion is. So you have the insertion and the origin, right? So it's basically pulling it tighter because it's making those two ends further away from each other. So he identified that. He goes, "Well, your pelvis is out." And then he identified that my adductor muscles, which actually function as a hip flexor, were super weak as well. And the funny thing with that was he tested me, had me stand up and pushed on my leg, like I tried to bring my leg up into a 90-degree position, like kind of like when you're sitting, but imagine standing up, bringing your knee up to your hip level. And then he pushed down on it with like 2 fingers and he goes, "Oh, you got the same problem as Linford." And I'm like, "Who's Linford?" And he points up on the wall and there's a picture of him with Linford Christie, who was the 1992 100-meter Olympic champion.
Wow.
And it says on the picture, "Larry, you're the man." Linford Christie. And I'm sitting there and then, I'm 16 years old and Linford still, because it was 1995, Linford was still the Olympic champion at the time. And I'm sitting there going, holy crap, just, blown away that he's like, "Oh yeah, that's Linford. We're buddies."
No, that's awesome. And that's, I'm sure, inspiring in terms of, first of all, going from 6 months to recovery in 2 sessions.
Mm-hmm.
That's phenomenal. And
Yeah.
what you talked about with the pelvis and the hip flexor, these are such common problems. Like you see all these people walking around with their belly sticking out and slightly crooked gait. And how is this like a prolific, like everybody's got it going on type thing?
Everybody's got something going on.
Yeah.
It's like taking your car to a mechanic. If you come to me, I'm going to find something. It's not necessarily going to be, "Oh, this was going to be detrimental for your health." For some people, all it is okay, you're functioning. I like to use the word suboptimal. You're not, this isn't going to lead to you tearing your hamstring, but it's going to lead to you not being as strong, not being as flexible, not being as energy efficient when you walk or run. So all these things, and then they just cannot compound. So you get a little bit of a problem, and then that becomes another little problem, and then you like right now I've got a bit of a knee problem because my hip on my right side wasn't moving right, and my knee's compensating.
Mm-hmm.
And I hadn't been to any chiropractors for a while because I was traveling, and then I got back and I just didn't prioritize it. But again, it's one of those things that, I'm telling patients to do this, and I paid the price because I wasn't doing it myself. Had I got my regular maintenance treatment, he would have picked up that my hip wasn't moving, and I wouldn't have a knee that's giving me problems now.
So if you were going back to when you fixed your hamstring, if you hadn't got that treatment, would it have healed? Would it have progressed and become something chronic? I'm just trying to understand for the people that are out there that have some kind of chronic condition, are these things like requiring deeper investigation and reversible, or is it more like it progresses with time and you just can't fix it?
I'm not sure. I think eventually I would have been able to run, but I don't think I would have ever got back to the level that I did. Because after he fixed me up, I went on to university and ran track and field for the University of Windsor. I got 5th at the national championships in the pentathlon, which is 5 events. So, I still competed at a very high level. And actually I made 2 years after that, I made the national team and represented Canada as a junior.
Oh, very cool.
Yeah, so I got the same suit as all the Olympians and stuff, which was cool.
Very cool. So now everybody's hearing you talk about Canada and they're assuming that we're neighbors, but you're in Australia now.
Yeah, I live and work in Australia.
How did that happen?
Well, I actually tried to get into to chiropractic college in Canada, and it's pretty hard to get in. They usually have about 1,500 applicants when I was applying, and they only accept 150.
Oh wow!
So there's 90% attrition. So I was part of that 90%, and it kind of worked out for me because I wanted to travel, and I was looking at either going to the States or coming to Australia, and it worked out with the exchange. It was much more economical to come to Australia, and I would rather travel to Australia than, I'd never been to Australia, so I was like, I'd rather go to Australia than go to Chicago or New York or something.
It's funny how things work out, because so the reason we were connecting today and what I experienced with you on site at the biohacking conference was this unique technology you work with called Shockwave, right?
Yep.
And it's kind of like you needed to go through this journey of leaving home and flying overseas and meeting different people, and then eventually you landed on this treatment because of that, and now you're doing stuff that's so innovative in the chiropractic world and growing it like globally, which is awesome. So let's dive into that.
Yep, cool.
I'll fast forward a long time. You're really good at what you do. I can testify to that because my shoulder's not crooked anymore. And you've now incorporated technology, which for the most part, a lot of people haven't heard of, to hyper accelerate the outcome of your work, the healing, the recovery, the removal of pain, the treatment of joints, etc., all that stuff. Yeah. So what exactly is Shockwave and how does it work?
All right, so I'll give you a bit of backstory here with Shockwave. So originally the way they figured it out was soldiers coming back from the Second World War. They were coming back with like these problems in their lungs. What they figured out was when bombs go off, they create shockwaves. Everyone's seen it, the picture of, like the atom bomb going off and it blasts away that little house,
right.
That's a shockwave. That's just a humongous one. Mm-hmm. Okay. So when you have a grenade or something or a bomb drop from a bomber go off near you, it creates they're acoustic sound waves, and it travels through your body. It's another good one that comes to mind is sometimes I show it, bit of a nerd, is the start of the Lord of the Rings. When Sauron gets his hand cut off and then he he kind of explodes and knocks over all the soldiers.
Yeah.
That's a shockwave.
Right. Okay.
So those are really big ones. And it was causing damage to the lungs of these soldiers. So that's how they figured out what those were. And then based on that, they said, oh, shockwaves are destructive. And they found that it caused changes in bones as well, and calcium and whatnot. So they eventually developed a device that they use to break up kidney stones. It's called lithotripsy. The proper name for shockwave in literature is extracorporeal shockwave therapy. Okay? So with lithotripsy, there's two types. There's an internal and an external one. So internal one, obviously, they go inside you to break up the kidney stone, and the external one, they just put it, on your back. But they're very high energy shockwaves. So they're destructive when they're very high energy. And what they were noticing was some of these people, after they were getting their kidney stones blown away, they were like, oh, my back pain's way better. They'd only had, say, like kidney stones for like 3 months. And they're like, I've had back pain for like 10 years. And so they started investigating what it was doing. And they were noticing it was having beneficial effects on the soft tissues, like the muscles and the tendons and stuff like that. So then they developed in the early 90s musculoskeletal shockwave. So they just brought down the energy from the lithotripsy, and they found it was having really beneficial effects on soft tissues. So that's kind of the background how that developed. And as I said, a shockwave is just an acoustic sound wave that it propagates through a medium. Through water, it loses very little energy. So when we use shockwave therapy on people, we have to use a contact gel, like what they use for like ultrasounds.
Right.
Because otherwise, if you just put it right on the skin, you lose like 99% of the energy.
So what I get what's going on. There's an audio wave, and you painted a picture for us with the Lord of the Rings and the atom bomb, lighter version of that.
Yeah.
What is the actual mechanism that causes healing? There's a sound wave entering your body, and then what?
Yeah, so it causes so there's a rapid rise when we make the shockwave. There's a rapid rise beyond ambient pressure, and then it drops down below ambient pressure, and that causes like this implosion. All right, and these implosions they cause the release of what we call cavitation bubbles. So you cause these like implosion bubbles that occur in the tissue. And then that causes physiological changes into the cells and the tissues. So some of the physiology is it stimulates mitochondria, it stimulates endoplasmic reticulum, it stimulates mRNA, it stimulates stem cells. So there's multiple studies showing how it stimulates all these structures, and then that leads to a chemical cascade that causes all these changes in healing and repair. I tell people like the simplistic answer to it is these sound waves. Basically, I'm going to create more repairmen in that area. So if it's your shoulder, I'm going to actually cause a little bit of inflammation in there, but that's what acute inflammation is, what makes things heal. It's only chronic inflammation that's a problem, because that's what your body does. If you tear a muscle or whatever, it swells up and then brings in all these chemotactic factors, the repairmen. So you have your tenocytes, your fibroblasts, your osteoblasts, all these cells that repair things. They come to the area and they start cleaning up. So it'd be like if you went into a shopping, like a grocery store, and you broke a bunch of jars of pickles on aisle 5, someone from the grocery store would come and clean it up.
Yeah.
Right. But if I just walk down aisle 5 and I don't break anything, no one's going to come And that's kind
Yeah.
of how the body works. So I'm saying, hey, body, come here to aisle 5, clean up this mess.
Yeah. So you're signaling, so you're literally promoting inflammation to signal healing mechanisms in the body. Like our body already knows how to fix these things.
Yes.
And you're just drawing attention to a specific site using the shockwave.
Yeah. Because often when we heal, when our body heals like mine did from the fall of that, from learning to pole vault, it didn't do a very good job. Like it mended the muscle, but the mechanics and the physiology weren't optimal. And that's why I kept having problems when I ran. And so what Dr. Bell did was he identified that and restored. That's all he did, was he just restored normal. He didn't make me superhuman or anything. It's just, and that's kind of what I do when I treat people, is like, I know what normal looks like. So abnormal sticks out. And then I'm just like, okay, you've moved a standard deviation or 2 away from optimal. I have to move you back. And the tool helps me do that.
So when you're doing this, I experienced it, right?
Yeah.
And what I learned, what I guess I should say what my body learned, was that there was innate suboptimalities, like you're talking about.
Yeah.
And there was innate sort of postural, structural type problems that I was kind of ignoring. And then the healing, by the way, in one session, I sat with you twice, I think, over a period of a couple of days.
Yeah.
I literally noticed the alleviation of problems that I didn't know were there. Right. So there was this lightness, there was this mobility that I didn't realize there was a lack of mobility to begin with. So what you're explaining now, why all this happened, but it's not just about repair, because that's kind of what you've been saying. It's also more about restoring like youth, because I truly felt like I had greater range of motion after we were done.
Oh, you did? Yeah, you did. I measured it. Yeah, you certainly did. It's so again, and I joke with patients and I go, that's what normal feels like.
Yeah.
So again, I'm restoring. You deviated.
Yeah.
Your body compensated for suboptimal function, biomechanics, whatever. And therefore your body, it moved from plan A of how to do things and move to plan B. And some people even move to plan C.
Right.
And then that's where the problems come in. And if you're always operating on plan C, you're just not operating very well at all. And you're gonna run into problems, and you're gonna often run into pain, dysfunction, all this stuff. And it's stuff that's very fixable. And I get kind of irritated when some practitioners, tell people like, oh, you're just gonna have to live with this, or it's just like old age. And I'm like, well, think about it. If it was just old age, every single human on the planet your age would have this problem.
Yeah.
Right? And I'm like, that's not the case. Because I've treated 10 other people today that were older than you that didn't have this problem.
Yeah. So speaking of that, like thinking about conditions and how you feel, so the first place we go to when we typically think about chiropractic or something like what we're discussing here is like pain. We're treating chronic pain.
Yeah.
What else should we be thinking about that maybe not be obvious that this is the right solution? Because you're thinking about dealing with the body in a functional manner, and people are thinking more symptomatically. So what are all the various areas that people should be looking at this?
So if we're talking about pain, the way I'd like to explain pain to clients and patients is think about it as a signal. Okay. Mm-hmm. Stop thinking of pain as a bad thing. Okay. And one of the analogies I use is it's like a baby. Okay. The baby's crying. That's pain. Why is the baby crying?
Yeah.
It's hungry. It's tired. It needs a nappy change. It needs to be put to bed. It needs some cuddles.
Mm-hmm.
Right? So if the baby needs a nappy change and it's crying because it needs a nappy change, and you change the baby's nappy, what happens to the crying? Goes away.
Yeah.
Right? So that's how the baby was signaling that it needed something. Think of pain in your body like a crying baby. Your shoulder's sore. That's your shoulder crying, saying, I need some help, please. So instead of taking a pill to down-regulate that signal or stop it, which would be the equivalent of putting duct tape on a baby's mouth and going, solve that problem.
Yeah.
You haven't. You've solved the sound problem. You're no longer having to hear the baby cry, but the baby still has a problem. Your shoulder still has a problem. You've just stopped the signal from your shoulder to your brain saying, ow. So that's what I try and get people to realize and think of pain as a signal from your body telling you it needs something.
That makes a lot of sense. But are there any types? So there's a lot of people walking around with chronic pain, meaning it's been 2, 3, 4, 10 years maybe.
Yes. Yeah.
Are there certain forms of pain or reasons for pain that aren't going to go away?
Yeah. So again, pain's super complex. So what happens when you have chronic pain is actually your body will lay down more nerve endings in that area. So again, if it's a shoulder problem you've had for years and years and years, your body will actually lay down more nerve, like nociceptors, to make you more sensitive to pain. So now something, someone can just put their hand on my shoulder and that can cause pain, right? It'd be like your car alarm. If someone walked within 5 meters of your car alarm goes off. That's way too sensitive. You don't want that, okay? So there are ways of down-regulating those pain signals once they get into that chronic pain stage. And some, like I saw one chiropractor on a podcast, and he was showing like he uses like cotton buds to like stroke people's faces. So what you're doing is, if I'm up-regulating the sensory input from a different area, it competes with the pain. So if I'm just touching you lightly on your face, I'm lighting up that part of the brain. And if my shoulder is on this part of the brain and it has to compete with that signal. So it kind of down regulates that pain signal a little bit. So there's little biohacks to help with that. But also you have to address if there's any biomechanical problems, any, chemical problems, and then you can even talk about other, some people it's metaphysical, emotional, all these, I've had patients where I fixed everything biomechanically and structural in the shoulder, and then they still had problems, because one patient I remember clearly, his father had died a few months before, and so that was just grief and stuff in there. And once he actually dealt with his grief, his shoulder got better.
Wow. That is phenomenal. I love what you said about the nerve endings sort of developing. It's kind of the opposite of what people think. People think that I have pain is an injury and it's going to get better.
Yeah.
What your body's actually doing is, let's increase the pain to keep warning you that this is a no-go zone.
Yeah, it's trying to protect you. It's trying to protect it.
And so the pain you're feeling may not actually reflect what's really going on. It may be, it sounds like it usually is exaggerated as a protective measure. So if you keep masking the pain, you're never going to get rid of it, because that's the signal.
Yeah. Well, again, if we go back to the baby's now crying louder because you're not changing its nappy. It's going, well, I'm going to scream louder to get your attention. Yeah. Which it totally makes sense, doesn't it? Because if you're not addressing the problem, well, your body goes, well, I'll make him listen.
Yeah.
I'll make it so painful that he can't even do anything.
Yeah. And that's exactly when your body, like you so eloquently said earlier, start using plan B or even C in terms of mobility to mask or avoid the pain. And now all of a sudden that causes new problems because you're not moving in a natural form.
Yeah, you start loading like I did with my knee. The knee's a hinge joint. It can rotate a little bit.
Yeah.
But my hip is supposed to generate like 95% of the rotation in my lower limb, but my hip wasn't moving. So my brain was like, well, I'll try and squeeze a little more juice out of his knee.
Yeah.
And then that's made my knee unstable because now it's moving too much. And now I've got a knee problem. But again, a lot of practitioners will just look at the knee and just be like, oh, I got to treat the knee, treat the symptom.
Yeah.
Again, it's once you become really good as a practitioner, you start seeing the whole picture. It's not just a knee. Like Larry, my mentor, always says the knee does what the hip tells it to do and what the foot allows it to do. So it's just stuck in the middle.
So do all chiros think like this, or is there variable? Oh, okay. Well, that was a certain answer.
No, I wish they did.
Try Pectisol modified citrus pectin today and see for yourself how it can help you manage healthy inflammation levels to support your detox and weight loss goals. Listeners get 20% off with code UNPILL20 at ecoeugenics.link/unpill. That's ECONUGENICS.
How do you know? How do you know to run in the other direction, that you're not getting what you should be getting?
Oh yeah, well, that's a hard one. I actually wrote a book a few years ago called Back Pain, and there's a chapter in the book that there's a checklist of what, like, a good practitioner, the steps we usually follow. Obviously, I'm categorizing myself as a good chiropractor. I'm a bit biased, but you backed me up a little bit on that. And so did Dr. Mercola. He gave me a really good compliment when I was there, because I used the shockwave on him, and I was talking about the shockwave and how good it was, and he looks at me and he goes, "That wasn't the machine." He goes, "That was you using the machine." He goes, basically saying, like, other practitioners wouldn't have got the result that you just did with that machine. So I was kind of blown away. It took me a sec. When someone gives you a really big compliment, you're like taken aback a little bit. So I was like, wow, thank you so much. I appreciate that.
Yeah. And you remind me of something that I've heard, where, Raheel, who was at that event, who we both, I had met him previously, but we were both together. He said something interesting, which is that, one of the signs of a good chiro is that he's not trying to book multiple sessions. He's trying to get you done within a couple of sessions, meaning that what's possible is so much more than what's marketed. And so somebody who's talking to you about plans and how many months you need to be there probably isn't the right place to be. Somebody who's like, what's the problem? How do we fix it? And gets right into it and tells you you're done,
Yeah. Well, that's the run in the other direction kind of thing. Because my parents even had that. They went to a chiro when I was in university at studying here in Sydney, and they were like, "Oh, he wanted to sign me up for I think it was 12 months, like a 12-month plan. It was like $3,000." And I'm sitting there going, I am not aware of any musculoskeletal condition that requires 12 months of treatment.
Right.
So it's a shame, because what we do is very science-based, and it works, and it's reproducible. But unfortunately, some practitioners get stuck into the got to make money. Yeah. And it's easier to make money when you sign people up to a 12-month plan, because, I see Bob on Monday, I see Sarah on Tuesday, I see Dave on Wednesday. Easy. I don't have to worry about it. It's just a money-making machine.
And it's important to get paid for your vocation, but there's lots of ways to do that. So,
well, that's like my mentor, Dr. Larry Bell. That's what he said to me. He goes, I do well because I sort people out, and then they tell all their friends and family, and then their friends and family come and see me, and then I do the same. I fix them, and then they tell, and that's what I try and do. I get a lot of referrals because I sort people out.
Yeah. Yeah, that makes a lot of sense.
And that's what I tell people. I'm like, if you keep coming back over and over and over, I'm failing.
Mm-hmm.
Like, would you keep taking your car back to a mechanic week after week after week? Right? You'd be like, dude, you're not a very good mechanic.
Yeah.
Because I'm like a body mechanic. Now there are some conditions, again, that this has to be caveated. There are some conditions that aren't fixable.
Mm-hmm.
And I'll be upfront with those patients. I'll be like saying, you need ongoing regular maintenance treatments so this doesn't get bad.
Right.
I can only move, you're 2 standard deviations away from optimal. I can only move you 1. And then we hit a brick wall because you have structural changes or, things that I can't fix.
Yeah, it makes sense.
But I make them fully aware of that so they have informed consent. That's what it's about. It's about giving people a proper diagnosis, telling them what can and can't be done, and allowing them to make that choice.
Yeah. And what a lot of people don't know is that, so there's a lot of chiros that focus on the business end, which is, let me sell you some socks and let me sell you some shoes. And let me sell you, like, what does your insurance cover? And I'm going to sell it to you.
Yeah.
Right. Versus chiros are basically like neuroscientists. The amount of training you guys get on the nervous system, I would argue that there aren't many practitioners out there that have that in-depth knowledge. So the value of what potentially could be offered based on what you're trained on versus what typically gets offered because of the model of trying to run a clinic.
Yeah.
Right? There's a big disparity there. So try and find that person, because there's so much more that chiropractic can offer than just let me crack your neck.
Yeah. Well, one of the things, I have a friend that's setting up a program at universities here in Australia for chiropractors in terms of like lifestyle and wellness coaching. And he was telling me that we receive the most amount of training in terms of nutrition of all allied health practitioners.
Oh, wow.
Yeah. So. Wow. And as we know, I think you said in one of your podcasts I listened to, the doctor was saying they received like 4 hours.
Yeah.
I think that was Dr. Peter Attia. I listened to his podcast, and he was saying, yeah, I did 4 hours of nutrition training. And then we make them the gatekeepers of, it makes no sense.
And in those 4 hours, they're told, don't eat fat and go buy some bread.
Yeah.
Going back to Shockwave for a second, is this something that somebody can, like, because I just thinking of the nature of pain and physical management, like body management, the convenience of being able to do it often. Is this something that people can buy and do at home, or do you have to find a local practitioner? Or how does that work?
Well, you can buy it, but it's about $20,000 US for a unit. So it depends on how much you're willing to spend. But again, you got to know how to use it. Like I have one, and I use it on certain areas of my body, but obviously I can't use it on all areas because I can't really reach certain areas. But again, if you want your practitioner to have this available, you can get them to trial a device. They can contact me if they want to. I can hook them up with the right people in Canada or the US, and just try it out, because it is very powerful. It's very effective. There are some contraindications. So the contraindications are pregnancy, kids under 18, except for Osgood-Schlatter's, which is a knee problem. And that's not because we have any studies showing it's harmful. It's just because we don't have enough studies showing it's safe.
Right.
Okay. So people on blood thinners, because it's like a jackhammer. So it can cause some petechia, which is the little blood vessels that kind of pop and stuff like that. That's a kind of a normal side effect. But if you're on blood thinners, it can cause like more bleeding and bruising. So we want to avoid that. If they have any blood clotting disorders like hemophilia, stuff like that. If they've had cortisone injection. So if you wanted me to work on your shoulder, the caveat there is after 6 weeks, it's okay. So if you said I had a cortisone injection 3 months ago, I go, that's fine. But if you say I had a cortisone injection 2 weeks ago, I go, oh, I can't do it. What are the other ones? You can't do it over air-filled areas, so you can't do it over the lungs because it interacts with air again, and that can cause tearing. So I don't want to tear your lung. So remember what I was talking about, the soldiers being damaged by the shockwave? That's why. So even low energy shockwaves that we're using can cause damage. So you got to avoid over like the gut and over the lungs. And I think that's it.
Yeah, so it's like go ahead and buy it, but finding somebody that's qualified and understands how to use it. And I know I've seen more and more popping up at conferences. People can go test them. I haven't seen too many people in Canada using it. You probably know people. But I know all over the US, people can find it now. So it's awesome. But
the only one I left out was like the basic stuff, like if you have a local bacterial viral infection or like tumor. So
okay, makes sense. And I like what you said, because this is something that people don't do enough of. We think that our practitioners know everything.
No.
Right? Yeah.
No one knows everything.
Yeah, we think that they have all the answers, and whatever's in their four walls is all that exists in terms of what's possible. No. And I can tell you, I go to all the trade shows, all the events. There's very little that we know outside of even our local towns, right? It's local training, local school, local suppliers. You go to a different city and all of a sudden there's different companies making different stuff. So what you said, I haven't heard anyone say before, but it's brilliant, which is tell your doctor to call you and say, here's something that I think sounds interesting. Have you seen this? Right. And be the quarterback. Don't be, there's no entitlement on the doctor's end where they know everything and you know nothing. It's okay if you don't know something, right?
Yeah, well, and that's when I'm at conferences and stuff like that. That's what I'll tell patients, because they're like, how do I get this? Like, especially like in the States where it's brand new. I'll tell people, like, tell your practitioner to, find out about it. Again, I can send them, because it's been available for over 30 years in, Europe and Australia. Like, there's literally thousands of studies. So, so that's kind of the worrisome thing with new products, say like in the States, or get FDA approval, is it's new everywhere. That's not the case with this device. There's 30 years of clinical evidence showing like for tendon problems, like your plantar fascia, like plantar fasciitis, it's 80 to 85% effective. Like, name me a drug that is 80 to 85% effective. That just doesn't happen. Yeah. And it's non-invasive. Like your other options are like getting an injection, which in the bottom of your foot is excruciating. All my patients that had one, they were like, it was one of the most painful things I've ever had to experience. Now again, shockwave isn't pain-free, but I can adjust the pressure so that it becomes tolerable for you. Again, I joke at seminars and say, if your patient's crying and spitting up blood, you're going too hard. But that's just to hammer home the point that just turn it down. The problem is the studies actually show that the higher the pressure, the more beneficial the therapeutic effect. So practitioners, we get stuck on that. They're like, but the study shows if I go harder, it gets a better effect. And it's like, yeah, but you want your patient to come back. Like, it only works if your patient comes back, right? It's like if you hurt them really bad, it doesn't matter even if they get better. They're not going to come back. So
this is the challenge with a lot of papers and research. You see that it's all interpreted very literally and not in context. There's no functional interpretation. Like, if I actually apply this and look at the practical matters, the interpretation changes a lot.
Exactly. It's like, how about you put that on your foot and see what it feels like at 3 bar and see if you could tolerate, 3 minutes of that. And most people wouldn't be able to. So I always base it on the patient's comfort level and their ability to, but I also make them aware while I'm doing it that if you can handle more, you'll get a better effect. So again, that's that kind of informed. If they know what I know, even a little bit, then they can get on the same page. Because if they're just like, oh, Adam's just being a, sadist, right? Sadist is when you do it to someone else, right?
Yeah.
So, but that's not the case. If they know that, at the higher pressure, it causes better physiological changes, and I'm going to get better and fewer visits. If you're aware of that, then you're like, okay, I'll suck it up and, and take it. Whereas if you're just like, oh, it hurts, I don't want to do this, well, then you're going to tap out, or I'll have to turn it way down and you won't get quite the effect.
Yeah. Before we go, I just had a couple thoughts and questions that are just general about, chiropractic. I've been to many different chiropractors and had these varying opinions. So I just want to see what you think.
Mm-hmm.
So there's some guys you go to and it's within minutes you're getting your back and neck cracked. And that's the majority of the session. And then there's some guys that you go to that are saying, no, you need like this massage machine or you need some laser therapy. And only if that stuff doesn't work, I'm going to crack you up. So what is the truth there and where should you start?
Okay, that's a good question. So it really depends on a number of factors. Like when I go and I listen to some of the best practitioners in the world, like I went to Dr. Stu McGill's conference, and he's arguably one of the best back pain guys in the entire world. And whenever he answers a question, he's always like, it depends.
Mm-hmm.
The answer is always, and because he kept doing it the whole weekend, everyone kept asking, he goes, it depends. Give me more context. Give me more context. He goes, if you give me a very specific example, I can give you a very specific answer. So I know that's not a sexy way to answer it, but
that's a good answer, because then the truth is that when you hear somebody saying this is the only way to do it, know that you may not get the best answer or outcome.
Well, yeah. Like if someone calls me up and goes, Adam, I have back pain. How would you fix me? I'm like, I don't know.
Yeah.
The answer is, I don't know. It's like telling mechanic, oh, my car's not running. How would you fix it?
Yeah.
Well, how's he supposed to know? He's got to look under the hood.
Yeah.
And listen. So, but there are some basic premises that can be adapted to almost anything. Like, for instance, if movement is medicine. So when people had a patient the other day and his back spasmed out and he was like, oh, I can't move. I can't get out of bed. I'm like, you have to.
Yeah.
Because if you think about it logically, how do you get back to normal? Do you think laying in bed will get you back to walking and moving and doing that? Or do you think walking and moving will help you get back to walking and moving?
Yeah.
Right? But it's the pain thing. But a lot of what I do is I talk people off the ledge. I go, you're okay. You have back pain because you have an unstable segment and your back is spasmed up in order to give you stability of that segment. That spasming is causing lots of pain. And every time you move and that segment moves, again, that's the baby crying saying, ow, 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 I need some help.
Yeah.
So if you have instability, in his case, I just said you have to do core exercises in bed.
Yeah.
Get those muscles to stabilize that segment. Once it's stable, it'll stop sending that pain signal and you'll stop having the spasms.
Makes sense.
But it's hard when you're stuck in that pain cycle. Your brain doesn't really work that well. And you're like, oh, I don't want to do anything,
Yeah. And you think that what's the Band-Aid, right? As opposed to what's the work I need to do? What's the Band-Aid? Make the pain go away.
Yeah.
And
if you knew what I knew, you'd be like, oh, okay, that makes sense. Because if I had that, that's what I'd be doing, and that's why I always tell people the best question you can ask your practitioner is this: knowing all that you know, what would you do if you were in my situation?
Mm-hmm.
And I love answering that question because I'm not telling you what to do.
Yeah.
Because adults never respond to that. Here's what I would do if I had this problem, knowing everything I know.
Yeah, it makes sense.
I mean,
And
that's the best question you could ever ask.
Yeah, and sometimes you're just getting someone to think who's going to get that's become so routine that they're not bothering thinking, right?
Yeah.
So now, second thought for you, there's also this contradiction where I hear some chiros will say chiropractic work, especially when it comes to the adjustments, like the cracking, is something you do as a therapy in response to a problem. And then I've heard some chiropractors say that it's something that you do as a prevention and maintenance to keep your body aligned. And some chiropractors will say, well, that guy is just marketing treatments you don't need. So which one is true?
It's so I'll nuance that a little bit. So there are some studies that show that ongoing like maintenance chiropractic care can yield benefits in terms of function and health and well-being. Now, I often recommend for people to come back to get some level of maintenance, but like I tell people like once a month, once every 6 weeks, so like I'm telling you to come see me maybe 12 times a year max.
Okay.
And again, that comes down to what we were talking about before, where I can identify things that are going wrong before you have symptoms. So if I can identify you have a bit of a shoulder problem before your shoulder starts hurting, and I can nip that in the bud so that you don't end up with a shoulder problem that requires multiple visits or injections or surgery, how much is that worth to you? Right? So again, just like anything, if you can identify the problem early, it's way easier to treat, and you can prevent a lot of things. And but we do it with our cars, right? Do you get your car serviced?
Yeah, for sure.
Why do you get your car serviced?
Yeah, I don't want it to break down.
Right? Yeah. But with our bodies, we use and abuse them, run around at 100 miles an hour, and then expect it to function optimally. Like that's just kind of daft, isn't it? To just expect it to function without giving it any TLC.
Man, you got all the answers, and they're the right answers.
No, they're just my experiences, and again, I tell people it doesn't make me right. It's just, this is what I've learned. This is the wisdom I've gained from working in the industry for over 20 years. Yeah. And like I listen to podcasts. I drive 11 hours a week. So I'm listening to podcasts like 11 hours a week. So I listen to what some of the top experts in the world are doing and saying, and this is what they say and do. So it's not just me saying this. This is, I'm taking from my mentors like Larry and Dr. Stu McGill. There's heaps of them that I could name.
So, I wanted to thank you for the time, because first of all, I don't know what time it is in Australia, but I know it's not a convenient time.
It's early.
Second, I want to make sure people know how to connect with you. So if you don't mind, just repeat the name of your book if people want to look at it, and where to find you online. And if any practitioners are listening today that want to talk to you about Shockwave, for example, how do they reach you?
Yeah. So my book, I always forget because the main title is back pain, but the under part says how to build. The subtitle, how to build core stability for long-lasting relief. And so I'm a co-author, so it'll say Adam Gavine and Rod Bonello. Okay. So it just has a picture of someone's back. It's kind of blue on the cover. You should still be able to get it on most like Amazon or whatever bookstores.
Sure.
You can. If you can't, you can message me. My email is adam@backtofunction.com.au. So that's BACK CKTO function, one word, .com.au. And my Instagram is back to function. So it's back, BACK_TO_function.
Okay.
And I put up videos. I'm trying to get better at putting up more stuff, but I'm going to do a lot more videos on like tips and tricks, little things you can do to help your body, help function, help restore things, all that.
Amazing. Well, thank you for taking the time in the wee hours of the Australian morning.
You're welcome.
Informative, and this deep dive into the chiro world, I think will answer a lot of questions for a lot of people. So again, thank you for being here.
My pleasure. I look forward to doing it again sometime if we can.
Amazing. We'll see you then.
All right. Bye.